Bismillahirrahmanirrahim. Today's our lecture topic is Lyme disease, and the course is current trends in biochemistry. In this course we discuss different diseases related to the new disorders, rare disorders. Lyme disease is one of them. Lyme disease is a rare disorder that is not present in the Asian countries, but it is very popular or very frequent in the European countries and also in the America. Lyme disease is actually an infectious disease that is caused by an bacteria, Brolia bacterium, which is spread by the ticks bite. First sign of this disease is the formation of redness on the skin, that is on the expanding area of the redness on skin known as the erythema migrans. Erythema migrans that appears at the site of the tick bite about a week after it occurred. But this red spot or the redness on the skin is not itchy or not painful. But this is not only the one sign of this disease, because this disease contains many of the symptoms, and in many of the patients the redness of the skin not occur at all. But in common way, this is the this is considered as the first sign of this disease, that is the redness of the skin, and it gives the name of bull's eye. This disease is occurred in 3 stages. Lyme disease consists of three different stages. We start with the discussing about the stages of the Lyme disease. 3 stages of Lyme disease. First of all, we discuss the first stage of the Lyme disease. First stage is early localized Lyme disease. Second stage is early disseminated Lyme disease. Third stage is the late disseminated Lyme disease. Lyme disease is of 3 stages. The first stage is the early localized Lyme disease. The second stage is the early disseminated Lyme disease. The third stage is the late disseminated Lyme disease. The 3 stages of this disease is different in their symptoms and signs. We will discuss them one by one for your convenience. The first stage, early localized Lyme disease. This stage is also called as the acute stage of the Lyme disease. In this, the symptoms that present in the patients are skin rash, flu-like symptoms, chills and fever episodes, fatigue, headache, stiffness of neck region, swollen lymph nodes, sore throat. In the first stage, early localized Lyme disease, the acute stage of this disease is shown the different symptoms like the skin rash, flu-like symptoms, chills and fever episodes, fatigue, headache, stiffness of the neck region, swollen lymph nodes, and the sore throat. The second stage of Lyme disease is early disseminated Lyme disease. In this stage, if the first stage of the Lyme disease is not treated properly, then this leads towards the second stage of the Lyme disease, and this become the more worsen in this case, and the symptoms are to be more worse as compared to the first stage of the Lyme disease. This stage occurs after the bite of the ticks, 3 to 4 weeks, or after the months of the bite. Several weeks or months of this stage occur after the tick bite of several weeks or months. Symptoms of this stage are the redness is present throughout the body. Redness is present throughout the body. Chills and fever episodes. Fatigue, weakness, pain in legs, arms, vision changes, chest pain, heart problems, fissure, paralysis. In the second stage of the Lyme disease, early disseminated Lyme disease, which occurred after the tick bite of several weeks or months, the symptoms are become more worsened, redness occurred throughout the body, chills and fever episodes are more frequent, fatigue in the body, patient feel fatigue in the body, weakness and pain in the legs and arms, vision changes, the blurred vision may be occurred in the patients, chest pain, they feel the chest pain, heart problems, especially the heart palpitations, and the facial paralysis. What is the facial paralysis? Facial paralysis is the inability of the patient to move their face from right and left direction. They can't move their face in right and left direction. The third stage of Lyme disease is late disseminated Lyme disease, and this is the chronic stage of Lyme disease. In its symptoms, arthritis, neurological and cardiac symptoms, migraines, dizziness, insomnia, stiffness of joints, especially neck region, fogginess, numbness of legs, arms, hands and feet. In the third stage of Lyme disease, the late disseminated Lyme disease, this is the chronic stage. In this, the symptoms become more worse. Arthritis may occur in the patients, neurological and cardiac symptoms seen in the patients. The headache become more severe and it changes into the migraine conditions, dizziness, insomnia, the lack of sleep, sleeping disorder, the lack of sleep present in the patients, and the stiffness of the joints of legs, arms, hands, feet, and especially the neck regions. Fogginess of the mind, numbness of the legs, arms, hands, and feet. And if this condition become untreated and become more severe, then it leads towards the presence of the rheumatoid arthritis condition in the patients. These are the three stages of the Lyme disease. which are different by the presence of the symptoms in the patients. Let's we consider how can we diagnose this disease. Diagnosis. How can we diagnose this disease? There are many diagnosis ways. If the skin rash is present on the skin, then by the naked eye we diagnose that the Lyme disease is present. The rash of skin, presence of rashness or redness on the skin is the sign of this Lyme disease present in the patients. It looks like the bull's eye. It looks like the bull's eye. This is at the circular or and oval shaped rash redness may be present at armpits, back of knee, hair, ear and neck region. From the start of bite, its size. When the tick bites on the surface of the skin, then its diameter would be 2 to 3 centimeter in diameter, and it increases 2 to 3 centimeter per day, and at that almost 5 to 70 centimeter in diameter. And if it is untreated, it becomes itchy and painful for the patients. The second sign of diagnosis of this Lyme disease, the patient's history. If the patient lives at the area where the ticks are more frequently present, the ticks are actually the insects. The tick belongs to the genus of Laxorts. Insect. Tick is actually an insect that belongs to the genus of Laxorts. Third diagnosis is the use of ELISA test to check the presence of the antibodies in the patient's blood plasma. To check the presence of it caused by the Borrelia bacteria This is a infectious disease and caused by the Brolia bacterium. By knowing the presence of the antibodies present in the patient's blood, we can diagnose the disease is the Lyme disease. Third one, the microscopic test for the presence of this Brolia bacterium in the patient's blood. We can also know about the Lyme disease diagnosis. How can we prevent the Lyme disease to be occurred? Prevention. Next topic is prevention. Definitely, because this is a infectious disease and caused by the bacterium, we can be avoid this disease or prevent from this disease by the proper sanitization, and by the area where the presence of insects of tick is present, avoiding these areas. We should be aware of the presence of these insects, then we would be able to prevent themselves from this disease. Also, by using the insect repellents, we can be prevented from this disease. The treatment. As it is a bacterium, this disease caused by a bacterium, Brolia bacterium. So the first treatment or the after treatment for this disease is the antibiotics. Many of the antibiotics are present for this disease. Some examples are doxycycline, amoxicillin, cephalosporin. These are the antibiotics which can be used for the treatment of this Lyme disease. In case of Lyme disease, if you feel the redness of the eye or feel the symptoms in the body, by the diagnosis of this disease, you can take the different types of these antibiotics regularly for 1 to 2 weeks, and for the regular use of 1 to 2 weeks, you can be cured from this Lyme disease. But this is not only the treatment to be given to the patients, but we also goes through the different types of natural remedies which can be taken by the patients to cure this Lyme disease. The second alternative treatment for this Lyme disease is the natural remedies. With the use of antibiotics, these natural remedies can also be boost your immune system and can be helpful for the treatment of this Lyme disease. Non-starchy vegetables, mushrooms, protein rich diet, vegetables of different types, and fruits which are rich in the proteins. Walnuts, almonds, turmeric, ginger, garlic, fish, omega 3 fatty acids. These all are the natural remedies which could be taken for the cure of this Lyme disease. Non-starchy vegetables, which contains the less amount of the starch. The vegetables which contains the less amount of starch can be taken for the cure or for the boosting of the immune system. Second is the mushrooms. Mushrooms are very much effective for this disease because it reduces the inflammation present on the skin. The protein-rich diet, especially chicken, vegetables and fruits. Fruits from pineapple, citrus fruits, which contains the vitamin C, vitamin B1, vitamin B12, which contains the vitamin B12, vitamin complex, vitamin C and vitamin B rich fruits and vegetables, which contains the different types of vitamins present in them. They are very effective against the inflammatory diseases or the infectious diseases. Walnuts and the almonds, which have the very much effective against the and boosted up the immune system. By taking up the walnuts and the almonds, the immune system would be boosted up. Turmeric is a very important and contains a very important antioxidant activity. So that's why antibacterial and antioxidant activity is present in the ginger and garlic. So this is very much effective against the Lyme disease. Similarly, the fish contains the omega-3 fatty acids and also the diet which contains the large amount of omega-3 fatty acids. Fish oil is very important against the inflammatory diseases, against for the boosting up of immune system. So all by using these all remedies, we can lower down the problem caused by the Lyme disease and the inflammation caused by the Lyme disease. By taking these all types of natural remedies, you can boost up your immune system, and by boosting up your immune system better act against the presence of the foreign particles or the bacteria, and by killing these bacteria, you can be cured of this Lyme disease. Lyme disease is a very, very rare disease, and this is not a very dangerous disease or dangerous disorder if it treated at the time, and if it is diagnosed at a time, then it not be become worsen. But if it is not treated properly and not treated at the time of their activation, at the time of their onset, then this maybe leads to the chronic stage, and at the chronic stage it can lead to the formation of the for the complication of the Lyme disease, which is the rheumatoid arthritis in case of some patients. Hope you understand the main concept of this Lyme disease, and you can know about the idea of the Lyme disease, how it is occurred, as it is the rare disorder and it is not very frequent in the Asian countries. But by knowing about the symptoms of the disease, we can be aware of the different types of the diseases that's present all over the world. Lyme disease is one of them. If you have any questions regarding this lecture of Lyme disease, you can approach me on the WhatsApp group by putting the questions in the WhatsApp group, and also by going through the comment section and post the questions in comment area. And also you can approach me on my email address. I hope I will try my best to understand your questions and to answer your questions according to your demand. Thank you so very much, all of the students. Thank you for this lecture. And this lecture is about the Lyme disease. If you have questions, you feel free to ask me on the WhatsApp group, or either on the email address, or either by putting the comments in the comment section of the YouTube channel. Allah Hafiz. Thank you so very much. Allah Hafiz.